This particular topic is impact of COVID-19 on rural New Jersey. Next slide, please. So where do we sit in my division? I oversee the Division of Community Health Services, which falls under the Integrated Health Services branch within the department. There are 3 branches, we're one of 3. And the Office of Primary Care and Rural Health, which is the office that Marisol sits in, and that is the office that works with our partners in rural health. It falls within my division, and there are 2 other units there, Oral Health Services and Community Health and Wellness, which is our chronic disease prevention and control service. Next slide. What is rural? You've already heard from others on this, so I won't linger here, but we're going to just talk briefly on one slide, the next slide, about the rural urban commuting area and how that relates. So there are 10 codes that are used in these codes. You'll see that most of them are not considered rural. Number 1, metropolitan area core, urbanized area, and then you go all the way down to 9 is a small town with low commuting, primary flow of 10% to 20 to 30% to a small urban community. And then you'll look at the bottom 10 is rural areas, primary flow to attract outside of a UA or UC. So let's move to the next slide. Now, one of the things that was important to note when it comes to COVID-19 is that you've already heard from earlier speakers that the rural community was hit more harshly than other communities nationally. As of November 1, New Jersey had administered at least 1 dose of vaccine to 85.91% of all eligible residents, and that was of those that were eligible at that time in the earlier part of this year, which was the 12 and older. We know now that we are at 5 and above that are eligible for vaccines. So we've been making great strides there. But if you look at some of the counties that are that have rural communities in them, we're going to see the difference. So looking at Burlington County, overall, 87% of the population had vaccinated had vaccinations for those 12 and above, but you look at some of the towns that are rural, 42% for Wrightstown, 46% for Woodland, 48% for Bass River. Next slide. 2 other counties that have rural communities in them that were disparately impacted thus far with vaccination rates. Cumberland County, where you have Maurice River Township, 44%. Fairfield Township, 48%, and Commercial Township, 49%, versus the county average of 72%. And then finally, Sussex County, 76% on average, but 2 communities in particular, Walpack and Branchville Borough, 21% and 50% respectively. Next slide. So we have these specific counties that we were working with regarding our migrant seasonal farm worker population. We were working with them because we knew that they were going to be disparately impacted because of their access issues to vaccines. And so we had strategically been working on trying to get them to vaccinations or get vaccinations to them. And as you can see, Atlantic, Burlington, Cumberland, Gloucester, Hunterdon, Monmouth, Morris, Salem, Warren were the counties within New Jersey. We have 21 counties total that had migrant farm workers that we were working with. 9,100, close to 9,200 migrant farm workers in those particular counties, and then another 14,000 or so that are seasonal farm workers, and then the animal production workers. Most may not realize that New Jersey still does have a large number of farms, both horse farms and also other large seasonal agricultural farms. That's why we were called the Garden State. That's why we still are the Garden State. And then your total is over 25,000 people that fall within these categories. And you see in the next category, the products that fall within these. So you have cattle, for instance, and milk cows that are in Salem County. You have horse farms in Monmouth County, and the list goes on and on. Finally, that last column is the harvest months. We were looking at this very closely because we wanted to know when the people were going to be here that needed to have outreach, and we wanted to make sure that we reached them. Next slide. So in March, the department, along with agriculture and labor, worked to identify 330 farms that we were going to be able to work with. The survey identified 13,000 workers, and then an estimated 5,500 workers we believe are currently in the state. Again, the migratory nature of these individuals is that they don't stay in one state year round. Many of them, some do, but many of them are rotating from southern states into the northern states seasonally and then go back down to the southern states when the weather turns. And then there are some in New Jersey that just rotate throughout New Jersey. Roughly 9,300 doses have been given to migrant and seasonal farm workers since March of 2021. Next slide. Some of the myths that the community hears or may believe is that vaccines can cause people to attract metal objects. Vaccines are installing microchips to track people. Vaccines are deadly. That the community will know that they've gotten a vaccine. Mistrust of government is clearly an issue. Fear of sterilization, and then fear of immigration status being revealed. Next slide. So we always have to look at the social determinants of health. And here we know that income is a big issue that comes to play here in rural communities. Also, we do know that transportation, we know that in some instances, education or language barriers exist, and then health systems and services access. Next slide. Now, this is a different take on what Dr. Purnell provided in her depiction of equity and what we were seeking to achieve. And this one, I love hers. I also like this depiction because it shows you that the ultimate goal that we're looking for is liberation, where we don't have to have any things propping anything up, but where we've done all of the work, where everyone has the access, has the type of treatment that respects who they are and where they are. Next slide. So what do we need? What did we learn during this pandemic? We learned that we have to be transparent. We need to tell people what's going on, what we know at the time, and not keep things internal. We need to engage the public and be in listening mode always. We need to be culturally and linguistically competent in our messaging. And then we need to deploy individuals from within the community to assist in this work. We can't, assume that people are going to respect policymakers as the voice of reason on these topics. Next. This is it for me. Thank you so much for your time and attention. I know that there may be questions. Again, you can put them in the chat and I will try to respond to them accordingly. Thank you.